Like to call the meeting to order. I've been waiting all morning to use this gavel, so. Good afternoon and welcome to the Alzheimer's Association Cleveland Area Chapter 2015 annual meeting. I'm Ron Stansberry. I'm the newly elected chair of the board of directors of the Cleveland chapter. We're in June, obviously, although sometimes I think it's April. June is Alzheimer's and Brain Awareness Month, an opportunity to hold a global conversation about the brain, Alzheimer's disease, and other dementias. It's part of the Alzheimer's Association's efforts to increase awareness, to expand our international outreach, and to address this terrible and truly worldwide epidemic. I hope that by the end of today's meeting, you'll know quite a bit more about our work and our roadmap to change the course of this disease than you did when you walked in the door this morning. Our annual meeting is also the time for us to recognize our leadership and to thank our volunteers and our staff for another very strong year of providing much-needed support services to those in the community who are battling the disease. I'm happy to see many of our longtime volunteers and friends are here today. It's through our work together that we continue to help those who are going through the journey with Alzheimer's disease. Thank you all for joining us here today. Before I go any further, I would like to recognize and thank Beverly Charles from the Office of U.S. Representative Marcia Fudge. If you please stand. And also Rachel Reeves from the Office of Ohio Representative Stephanie House. I think is it. Thank you for joining us today and for your continued support for our mission and our work. With us today is Brian Rice, who has been an active volunteer for several years, including chairing the East Side Walk to End Alzheimer's. Brian has agreed to say a few words about why he volunteers. Brian?
Yes, my name is Brian Rice. I'm director for Griswold Home Care Lake Geog office, but I'm here today to talk about my volunteer efforts for the Alzheimer's Association. It started with a conversation with a friend of mine, Linda Bliss. She was a support group leader and mentor and encouraged me to do the same in Paynesville. And so I took the training and went to one of Linda's support groups, and I was exposed to the raw emotions that come from a support group. And it really kind of scared me. I kind of chickened out. And so I took some time to think about it, and then I came to an annual luncheon here, I think about 5 years ago, and I heard Matthew Baumgart speak. And obviously he's a big advocate for Alzheimer's Association, and the point that I remember him making was for each $280 that the U.S. government spends in healthcare for those with dementia, it spends only $1 on finding a cure. And so I'm a numbers guy, that number stuck with me, and then he took 280 pennies and he dropped them on the podium. And that really woke me up, and I decided that I have to go back and take a second look at that support group facilitation. And so I did begin to facilitate our own support group in the Paynesville area with Linda's assistance. The next step I took was as walk chair. Cheryl Berman approached me about starting a new East Side Walk. Although I was kind of apprehensive, remembering what Matthew Baumgart taught me, I thought I have to take action. I have to do something. And so we did. I did chair the event for the last 2 years. We raised over $220,000. And then the next step that I took, I have a friend, another conversation. It was actually a client of my office. Her name is Kim, and her husband had early onset Alzheimer's. And I felt really bad for Kim. She worked full-time, had a full-time career, had very little local support from her family. Her family mostly lived out of town, and so working full-time, trying to take care of her husband, I saw the challenges. So I encouraged her to come to our support group. I thought she might benefit from it, and that's where I learned the real story of Kim. And that's where she really began to inspire me when I saw the extreme amount of courage that she had to muster each and every day just to get up and go to work and take care of her husband. And so I began to talk to Kim about becoming an advocate herself. And when she was in the heat of the battle, obviously she was not prepared for that. She had to focus on the task at hand. But eventually, unfortunately, her husband did pass away. Kim began to examine her life, and she thought that she did want to make a difference. And so she did agree to come down on the bus with me, my first bus trip to Columbus, her first trip to Columbus. And on the bus trip down there on the way back, I got to know Kim even better. In the end, she has become a good advocate. And the one thing that happened there that impressed both of us is, it's a very lonely job what we do. A lot of times you walk away from a support group meeting, and I know there's support group leaders here in the audience, and all the frustrations and anger that the group is heaped on your shoulders. And you walk away and you feel like you're all alone in the battle. Then you go to Columbus and you see 350 advocates all there, and what a lift that was for both Kim and I, and it's an experience I'll never forget. So thank you to all the volunteers and advocates that are here today. Obviously, the mission cannot be accomplished without you, and I would like at this point to ask all the advocates and volunteers to take a stand. Please, right now, if you would, stand up if you're a volunteer or advocate. Thanks for all you do.
Thank you, Brian. Yes, we are so thankful for our volunteers, and each person brings a different strength to the organization. And we thank Brian particularly for his continued involvement with the organization. Last but definitely not least, what would our organization be without our staff? Truly outstanding. They're truly outstanding. Many thanks to all of you for providing the exceptional care and support that our organization has become known for, and raising awareness of the disease and the Alzheimer's Association in the community. You not only raise awareness, but much needed funding for research and our chapter's programs and services. You're the ones who are there every day. You really are the heart and soul of the Cleveland area chapter, and I thank you on behalf of the board of directors and the families that we serve. Will the staff members please stand and be recognized? As I said at the opening of the meeting, June is Alzheimer's Brain and Awareness Month. What better time to share with you, our friends and colleagues, our roadmap to change the course of this disease, because change it we must. Nancy Udelson, our chapter's president and chief executive officer, will talk about the Alzheimer's Association's response to the National Alzheimer's Plan, followed by Cheryl Konetsky, our vice president of programs and services, who will discuss how we can work together to help make our communities dementia-friendly, that is, until Alzheimer's is a thing of the past. Nancy?
I have to say, for those of you that were at Night of a Thousand Lights this year, you are much, much better behaved. So, it took about 20 minutes to get them quiet, right, Leslie? So thank you all. It began with an idea. In 2009, the Bipartisan Alzheimer's Study Group, co-chaired by former Speaker of the House Newt Gingrich and former Senator Bob Kerrey, released its final report. Among the recommendations was a call for better coordination among federal agencies and a national strategy for how to move forward in addressing the Alzheimer's crisis. The Alzheimer's Association took that idea and helped to write a bill in Congress known as the National Alzheimer's Project Act, or as we call it, NAPA. The association secured bipartisan sponsors in both the Senate and the House of Representatives and mobilized advocates across the country. 50,000 emails were sent to Congress. 112,000 signatures were gathered on a petition, and over 1,000 meetings were held between advocates and members of Congress or their staff. The Alzheimer's Association testified before Congress and negotiated changes to the bill in order to gather support and secure its passage. After it unanimously passed both the Senate and House, over 10,000 phone calls were made by Alzheimer's advocates to the White House, urging President Obama to sign the bill, which he did on January 4th, 2011. But creating a law that called for a national Alzheimer's plan didn't actually get us a plan. So the Alzheimer's Association began a campaign to turn the act into action. That campaign was focused on ensuring that those who've been affected by this devastating disease, individuals with the disease, their family members, their caregivers, their loved ones, as well as Alzheimer's researchers and other interested Americans, would have input on what needed to be in a national plan. The Alzheimer's Association held over 130 public input sessions around the country, hosted a national teletown hall meeting, and created a website to gather written comments. In all, 43,000 Americans participated in this process, and their comments were compiled and presented to those writing the plan. And on May 15th, 2012, the U.S. Department of Health and Human Services released the first ever national plan to address Alzheimer's disease with an overarching 10-year vision of preventing and effectively treating Alzheimer's disease by 2025. This will change the current trajectory of Alzheimer's disease, save millions of lives, and have profound economic and budgetary impacts. This was the impetus for the Alzheimer's Association to embark on its own rigorous strategic planning process to meet the 10-year vision set forth by NAPA. The results were both ambitious and bold. Given the enormity of the Alzheimer's crisis, the needs of our constituents and our society, and our role as the leading organization committed to putting an end to Alzheimer's, we must move boldly to achieve these goals. Currently, there are no treatments to prevent, cure, or even slow the progression of Alzheimer's disease. Based on the current trajectory, the number of Americans aged 65 and older living with Alzheimer's disease is projected to increase from 5.3 million today to 6.8 million in 10 years. By 2050, the number of Americans aged 65 and older living with Alzheimer's disease will skyrocket to 13.5 million if a cure or prevention is not found. In Ohio, we estimate that 210,000 people aged 65 and older are living with Alzheimer's. The projection is 250,000 by 2025, a 19% increase. Closer to home in Northeast Ohio, we currently estimate more than 50,000 people with Alzheimer's disease. Along with the growing number of individuals diagnosed with Alzheimer's is, of course, an equal escalating number of family members trying to keep their loved one at home as long as possible. Alzheimer's takes a devastating toll not just on those with the disease, but also to the people caring for them. We know the tremendous stress that is placed on family caregivers. 85% of unpaid help provided to older adults in the United States is from family members. Often, family caregivers lack the information and resources necessary to manage the increasing complexity of medication regimens and assisting with many of the activities of daily living, such as bathing, dressing, and feeding. Caregiving is never easy, but the support and experience of others can help ease the strain. And that is why the Alzheimer's Association has been providing compassionate care and life-saving support for more than 35 years. But we continue to ask ourselves, how can we stay relevant in the Alzheimer's space with the staggering projections we are facing in the very near future? Our 10-year vision is to change the trajectory of Alzheimer's disease, and to support those with the disease today and in the future. 5 strategic pillars were identified in our plan, each of which will be critical to our success. Let me briefly walk you through each one. Despite the number of people affected, many Americans still know very little about this disease. It still too often remains in the shadows, discussed in whispers, if at all. We must bring Alzheimer's fully into the open, explain the warning signs, address misplaced anxieties, correct misconceptions, and overcome the stigma that too often makes a terrible disease even more of a hardship. To this end, we invite you to join us in Going Purple this month, Alzheimer's and Brain Awareness Month, and in using our brains to help end Alzheimer's. This month will focus on educating people about healthy aging. At your seat, you will find a purple pledge card. How did I get to that one? Okay. We ask you to go purple for Alzheimer's and Brain Awareness Month and encourage others to do the same. Because everyone who has a brain is at risk for Alzheimer's. Expanding the title of our Awareness Month to include the brain helps broaden our reach to include not only Alzheimer's, but the importance of the brain to every individual and the commitment we have to our vision of a world without Alzheimer's, one of the largest diseases impacting the brain. And now the slide. Today, the Alzheimer's Association provides care and support to 700,000 people across the country. That's only about 2% of the diagnosed population. Our goal, admittedly a very ambitious one, is to ensure care for 4 to 5 million individuals. And we can't do this alone. Meaningful collaborations with other organizations and systems, many of whom are here today, is the only way to leverage existing resources and achieve efficiencies in program delivery. Conquering Alzheimer's disease is as much a matter of public policy as scientific discovery. By raising important issues and educating elected officials, we can help save lives. Whether you're comfortable sending emails to legislators, posting updates to Facebook, hosting events, or even meeting in person with your elected officials, there are many ways you can make a difference as an Alzheimer's Association advocate. Elected officials listen to the voices of voters and act on behalf of the will of the people. Communicating with elected officials will help us change the system to help all Americans who are fighting this disease. Elected officials make decisions every day about our healthcare system and Alzheimer's. Shouldn't we have a voice in this debate? The ultimate goal is a treatment that can completely prevent or cure Alzheimer's. But we know that even treatments that simply delay onset of the disease or slow its progression could have a dramatic impact on the quality of people's lives, federal spending, and our nation's economy. With appropriate levels of research funding, levels that are today still far below, we can accelerate the discovery and delivery of these desperately needed treatments. As a global leader in Alzheimer's research, the Alzheimer's Association has the highest impact of any non-governmental organization worldwide and is third overall behind only the U.S. National Institutes of Health and the Chinese government. Since awarding its first grants in 1982, the Alzheimer's Association has provided more than $335 million to over 2,250 best-of-field grant proposals in countries around the globe. Our International Research Grant Program funds investigations that advance understanding of Alzheimer's disease, help identify new treatment strategies, provide information to improve care for people with dementia, and further knowledge of brain health and disease prevention. This year, the NIH is expected to spend close to $600 million on Alzheimer's research. 3 years ago, an expert panel of scientists concluded that a ramp up to $2 billion annually is necessary to achieve breakthroughs in developing preventions and effective treatments for Alzheimer's in another 10 years. The chronic underinvestment in Alzheimer's research persists and continues to fall significantly short of the needed funds. You can see that smart investments have shown that research works. When a disease becomes a national funding priority, it absolutely makes a positive difference in treatments. Let me be clear. We are not suggesting that Congress and the NIH take money away from research into other diseases to fund Alzheimer's research, but to make Alzheimer's disease a similar priority in the country. Why do I keep doing it? We simply will not realize our 10-year vision without a significant increase in funds to support the mission. Growing the Walk to End Alzheimer's and our new signature event, The Longest Day, are the primary vehicles to increase large-scale revenue growth. We are expanding our base of volunteers and are committed to training and developing volunteer leaders to take the lead on these events. Our goal is to double revenue by the end of 2025. Aggressive? Yes. Audacious? Yes. Necessary? Absolutely. The Alzheimer's Association has a vision and a commitment to serve every family that is confronted with a diagnosis of Alzheimer's disease, to ensure they are referred to us quickly within days of receiving their diagnosis, and to stay with these families throughout the course of the disease, supporting them with our key programs of helpline, care consultation, support groups, and community education and outreach. This is not just a dream. We have a plan. We know it is needed. We can achieve this, but not alone. We need community partners who will help us expand our capacity, our operation, and the community's awareness of the unparalleled resource we bring to bear on their journey with Alzheimer's disease. We can make a difference to many more people with expanded relationships across the healthcare landscape and a shared commitment to our family and friends that they are not alone in their Alzheimer's journey. I'd like to introduce Cheryl Konetsky, our chapter's Vice President for Programs and Services, who will share with you the next step to realizing our potential to make a real difference in our community.
Thank you, Nancy. It's so great to see so many familiar faces in a sea of purple here today. I'm glad you all took the step to go purple in what you're wearing and our support for our program, and hope you take the next step with the Purple Pledge, as Nancy mentioned, on your table there. So it's not always easy to take time out of our busy schedules for one more meeting. But your presence here today suggests that you care about the issue of Alzheimer's disease and about those living with Alzheimer's today. As you heard Nancy describe, Alzheimer's has several areas of focus, from enhancing care and support to accelerating research. But none of these areas can be accomplished without increasing concern and awareness. It takes concern about the disease as a priority in our community and awareness about the challenges that Alzheimer's creates in order to motivate change. One of the concepts that I'd like to speak with you about today is about dementia-friendly communities. And it is one that is very closely aligned with public concern and awareness. While it is not a new idea, it is one that is gaining momentum in the UK, other parts of Europe, and here in the US. Specifically, Minnesota has a very sophisticated program that was created by a separate group called ACT on Alzheimer's, and it is having a positive impact in their community there. So what does it mean to be a dementia-friendly community? Becoming an informed, safe, respectful community for people with dementia involves emphasizing changes that identify it as a good place to grow up and grow old, to support its residents of all ages and abilities. It's a place where awareness and compassion transform attitudes and reduce the stigma of Alzheimer's disease, where supportive care options foster quality of life, where there are opportunities to maintain meaningful engagement and family members are supported by the community. What an amazing concept. So here's a glimpse of what a dementia-friendly community could look like. Early diagnosis and quality care. A network of healthcare providers that work together to diagnose and support individuals who report symptoms and concern. Trained hospital staff and modified procedures in the hospital to support patients with dementia. Specialized memory loss supports and services, like the Alzheimer's Association, adult day programs, and other community services providing support and resources. Dementia-aware and responsive client services, home care, assisted living, long-term care facilities that have progressive and highly trained staff. Welcoming and supportive spiritual environments that are inclusive and perhaps delivered modified religious programming. Independent living and meaningful engagement. Additional ways to maintain living in one's home and opportunities to participate in the community. Emergency preparedness and response. Trained police, fire, EMS professionals who understand how to support individuals with dementia in crisis. Accessible, user-friendly transportation that encourages access to the community, and dementia-friendly businesses with customer and employee support to welcome and encourage people to still maintain normal activities in the community like shopping and dining. So if you're like me, you have the realization that we're not starting from square one. Northeast Ohio has many of these services and features already. In some places more than others, of course, but the foundation is here. We just need a more coordinated effort to move this idea forward. It is also important to note that when we talk about the idea of dementia-friendly communities, it is one of a spectrum of concept. That while we would all love a fully transformed dementia-friendly community right now, today, we will not get there overnight. However, each little step that we take can make a difference, and many of you here today actively work on making this happen with the programs and services and the care you provide. We are already on this map. I'd like to share with you an example of a program that the Alzheimer's Association became interested in and started that began back in the spring of 2014. One of our family members who cares for her husband with Alzheimer's disease and who's very involved in our services shared with our program committee several examples of challenges that she faces and that of other family members that she knows who also participate in our service. She described going to eat with her husband, going out to eat, and worrying what the waitress would think when she was having to take over ordering for her husband. or having to apologize and explain to the cashier why her husband was trying to put the items on the conveyor belt back into the grocery cart before she had scanned them. She describes having always had an active lifestyle and for the first time wondering if it wasn't just easier to stay home. Not only was this a sad story, but it was a very clear example about how this disease does lead to social isolation. Our chapter's program committee thought that this situation needed a solution, and a subcommittee was formed. After the group had much discussion about the need to educate store employees about how they could better support individuals with memory loss and other dementia, and how it might be possible to do that with our already stretched staff resources, it was decided that we would work on creating enhanced business cards, much like a model that we had been using for a number of years. Some of you might be familiar with the fact that our helpline business cards for a long time had a phrase on the back of the card that said, "My companion has memory loss, thank you for your patience." And we would get requests and calls and just so many people interested in having those cards available on them so that when they were out and facing a uncomfortable social situation, they would be able to take that card and hand it to the employee that they're working with. And we knew these cards were very popular, but the committee decided to take this a few steps farther. So what we ended up doing was creating We Connect cards. And again, in taking this concept a little bit farther, the card on the left says, "My companion has memory loss, thank you for your patience." But it provides 4 very simple opportunities that the employee can do to help that person right then and there. Speak slowly in short, simple sentences. Please be patient, allowing extra time for response. Give direction 1 at a time. Limit choices to 1 or 2. We had a very much discussion over which 4 we were going to put on this card, and I've had many other suggestions like smile. How important it is for someone to just smile as they're doing and giving an interaction or helping someone. So we have a lot of other ideas that we can create different versions of this with. The beauty of this card and this approach, because we were debating quite a bit over would it be better to do education of the employees, is that we all know you can come to an education program, but it doesn't always translate to change in action. And we would be dealing with many shifts of staff, staff turnover, lots of challenges when you think about how to affect change through education programs. But if an employee has this card and cares enough about making a difference right then and there, the education happens right through using that card. So we knew that that was going to be a first idea to try. The second card on the right, the purple card, is a thank you card that developed again from the family members that I was sharing with you about. What they were doing was they were taking our helpline business card and writing a thank you note to the waitress or the teller or the cashier that they were coming in contact with who gave them great service. So the purple card says, "My companion has memory loss, thank you for your help. We appreciate the help that you provided." I'm going to have to read it off of one of these cards because I can't quite see over there. "We appreciate people and businesses that provide exceptional customer service for people with memory loss, like speaking slowly, being patient, and providing simple choices. You did that today, and we thank you. We will be back, and we will also let other families know." So right then and there, that employee who took the time to go the extra mile is receiving that positive reinforcement and knowing how much that little effort that they did made a difference in this family's life. So the kind of rounding this whole concept off is the back of the card. So on either of those 2 front cards, the back of the card is what's on the bottom. And what we wanted to do to take this to the next step is to say, please share this with your manager and a message to the manager. If you would like to know more about how your company can support individuals with memory loss, please contact. And we have Stephanie Baker, who's one of our education and outreach staff, who's on the contact of the back of the card. So that if a business wanted to have that education, if they wanted to do something very particular in training their staff, there was a way that they could contact us. Since we began rolling these cards out, I think it was February or March, we've had to reorder 3 or 4 different times in quantities of thousands. They are getting out in the community. We're very excited. We're getting requests. And what I'd like to share with you today, and they come in this convenient, handy purple business card holder. We will have these in the back of the room on one of the programs and services table, so that if you're interested in seeing them firsthand, if you know anybody who can use them, you are welcome to take them as you leave. We also have an informational flyer. So we're getting calls for these starter packs, and we send them out to individuals free of charge, whether it's the initial starter pack or the refills. So we're really excited about this one step that we took. But it is just one step, and in doing so, we know that there's so much more we can do. Our chapter, as a basis of this, is interested in convening a dementia-friendly communities task force, starting early this fall to begin having other conversations about how we can collaborate with service providers and community partners to take other steps and to begin having a broader conversation. I would welcome all of you to please consider joining the task force. We have sign-up sheets in the back of the room that will be available at each of the information tables on your way out. And during the month of August, I will be contacting everybody who's interested, and we'll be starting to form a schedule of meeting times and dates. And it should be a very exciting project, and I welcome everyone to consider participating. Before we get to the call for action today, I just wanted to highlight a couple other items that you have on your table. As Nancy mentioned, you have Purple Pledge cards, and we encourage you to take the Purple Pledge for June. But you also have a sheet that's called By the Numbers, and it's a piece that we started putting together. Last year was our first year, but in a synopsis really highlights the depth and scope of our programs and services. You can see the number of helpline calls that we take in a year, the number of care consultation hours that we put in, the support groups, the education programs, all of the programs and services, and its impact on the community. I welcome you to share this information and pass it on. We do have additional copies if you're interested. The other thing at your place is this purple awareness ribbon. And keeping with the theme of June being Alzheimer's and Brain Awareness Month, we welcome and encourage you to place this magnet, whether it's on your car, at your work, filing cabinet, refrigerator, share it with someone who could use it, pass it along, display it, and help us increase awareness in the community. So one thing is clear. There's a lot of work to be done in order to fight this disease and care for those who are living with it today. I hope that everyone here can move this cause forward, and commit to doing at least one thing in honor of Alzheimer's and Brain Awareness Month. Form a Walk to End Alzheimer's team. Take the Purple Pledge. Advocate. Join the Dementia Friendly Communities Task Force. Volunteer, or register to participate in Trial Match. It is important that we all work together to change the trajectory of this disease. Thank you very much.